and welcome back to the channel. Today we want to talk about a topic that might not be that beautiful, but it's a really important one, which are chlamydia. They belong to the so-called STDs, so to the sexually transmitted diseases. They're caused by the bacteria Chlamydia trachomatis. Let's take a look at the epidemiology. It's estimated that around 4 million infections occurred in 2018. Therefore, it's the most frequently reported bacterial sexually transmitted infection. However, we have to keep in mind that there are numerous cases that are not reported because most people are asymptomatic. Chlamydia is common among young people. 2/3 of the infections occur between the ages 15 and 24. And it's estimated that young women between the ages 14 and 24, that 1 in 20 is affected. Let's take a look at the pathophysiology. So, Chlamydia trachomatis is a bacteria and has a life cycle which consists of two morphologically distinct forms. First, it attaches to a new host cell as a small spore-like form which is called the elementary body. This elementary body then enters the host cell and gets surrounded by a vacuole, which is called inclusion. Then we have the so-called reticulate body, which substantially modifies the inclusion. Thereby, it makes it a more hospitable environment for the rapid replication of bacteria, occurring in the following 30 to 72 hours. So then we have numerous intracellular bacteria that transit back into the elementary bodies. Then they cause the cell to rupture and get released into the environment. And those new elementary bodies can then be shed within the semen or released from epithelial cells in the vaginal or in the female genital tract in general, and thereby attach new host cells and infect other people. When we're taking a look at the phenotype, we have to say once again that most people are asymptomatic. If there are symptoms, they include genitourinary cases and present themselves as genital discharge, vaginal bleeding, itchiness, painful urination, and also other symptoms. And in general, they can be similar to those of urinary tract infections. It's also feasible that it presents itself as an inclusion conjunctivitis with redness, swelling, and discharge from the eye. It's also possible that the bacteria infects the lungs and thereby causes symptoms of a respiratory infection, like a runny or stuffy nose, low-grade fever, and in general symptoms associated with pneumonia. It can also infect the chorionic vein tissues of pregnant women and thereby affect pregnancy outcome. There are numerous ways to diagnose chlamydia, and there's a very common one called a nucleic acid amplification test, but also cell culture and others. Those NAATs are the most sensitive ones, and they can be performed rather easily when we have something like a vaginal swab or urine. And vaginal swabs are actually the most effective way for screening in women and urine for men. So now, if you have chlamydia, how is it treated? So it's actually easily curable with antibiotics. People with chlamydia should furthermore abstain from sexual activity for at least 7 days after the first dose because, well, they want to prevent spreading the infection to partners. Repeated infections are common, and especially women whose sex partners have not been treated appropriately, they are at a high risk for reinfection. For women, this is pretty serious because having multiple chlamydial infections increases the risk for serious reproductive health complications, including pelvic inflammatory disease and ectopic pregnancy. So women and men should be retested about 3 months after the initial infection to ensure that they no longer carry the bacteria within their bodies. So this was a quick overview of this sexually transmitted disease. and I hope it gave you a good overview of the most important facts. If you liked this video, don't forget to give it a thumbs up and to subscribe to the channel to see weekly uploads. See you in the next video.